Hi, everyone. Thank you, Dirk. Thank you so much for having me here. So I'm really excited to share some of the research that we've been doing in my lab. And as you can see in this title, I'm going to use structural priming and syntactic priming interchangeably because they mean, pretty much the same thing. So that you know. All right. Before I get started, I want to acknowledge our funding source from the NIH and also the former and current members of my aphasia lab who are apparently very active, as you can see in this picture, and also my collaborators, especially Vic Ferreira at UCSD and Nedim Martin at Temple University, who have been working with me on this topic for the past few years now. All right. Let me get started by showing you this speech sample produced by one of our participants. And I'll give you a few seconds so that you can look at it and try to understand what this patient is trying to convey. Okay. So I assume many of us here are aphasia researchers, so probably you're familiar with the WA picture description, and you could probably guess what this person with aphasia is trying to say. However, if you couldn't, so if you had difficulty understanding the patient's speech, and hopefully you noticed it is in part because this patient's speech was quite limited to use of single words primarily, when in reality, we communicate in sentences to convey what happened, as well as who's doing what to whom. So successful production of sentences require grammatically encoding messages into well-formed sentence structures. So during this grammatical encoding, speakers will have to assign thematic roles or functional roles to lexical items, and then assemble them into correct phrase structure representations. And also, morphological encoding may also have to happen in order to sound out before they sound out sentences. So these grammatical encoding processes happen quite effortlessly and almost unconsciously in typical speakers like us. However, grammatical encoding is impaired in many patients with aphasia, resulting in difficulty producing and understanding simple to complex sentences, not only in spoken modality, but also in written modalities. So, for example, sentences that are reversible in their meaning, such as the girl chases the man, is difficult for patients with aphasia to produce and understand because you have to rely on grammatical knowledge to figure out who's doing what to whom, compared to irreversible sentences such as the girl chases the ball, where the ball cannot be the chaser. So you can use word knowledge. We also know that sentences that involve encoding greater number of verb arguments, such as dative sentences, the man gave flowers to the woman, is more difficult for patients with aphasia to produce compared to sentences that require a smaller number of arguments, such as the man bought flowers. And also, it is already well known that sentences with non-canonical word order, such as passives, are difficult for many patients with aphasia due to their increased syntactic complexity. And last but not least, another example would be sentences involving syntactic ambiguity, such as the woman poked the man with an umbrella. So these sentences can be difficult for patients with aphasia to process. Okay. So currently, the theories of aphasia, they tend to attribute these difficulties to limited processing efficiency in patients with aphasia. In other words, although they do have somewhat preserved grammatical knowledge representations in their system, their ability to activate or compute these linguistic representations are not as efficient after brain injury. So some supporting evidence would include patients can detect grammatical violations that are included in sentences, although they cannot quite fully produce those sentences grammatically, indicating that they do have knowledge of grammar. And if we use sensitive real-time measures such as eye tracking, we do see evidence of preserved and timely linguistic operations, such as patients looking at the filler at the gap side during sentence comprehension. And also some of the work that I did using eye tracking in sentence production have shown that patients with aphasia, especially agrammatic aphasia, they do show early access to overall large syntactic structure, and they tend to use advanced planning of sentence structure to facilitate more fluent and accurate sentence production. And some theories, they also suggest that, the grammatical deficits or agrammatic speech that we see in these patients may reflect adaptation strategy to limited processing resources in these patients. So then the question that arises, and this is the question that I'm mostly interested in, is how could we then improve access and use of grammatical knowledge in patients with aphasia? Currently, however, in our current aphasia treatment research, there are very few treatment options available that target language production beyond single words, as listed here. And as we know, these treatment approaches have made substantial advancement in aphasia rehabilitation. However, some of these treatment approaches, they tend to rely on heavily explicit metacognitive skills to learn specific grammatical rules to formulate certain sentences, which may not be most suitable for some patients with aphasia. In addition, memorizing situation-specific utterances, like in the case of script training, they do not fully engage the generative ability of the language production system, limiting the generalizability of training outcomes across different contexts. In addition, some of these treatment approaches can be quite difficult for patients with aphasia to remember and follow, as they tend to involve multiple complex steps of thinking about specific grammatical components, such as what's subject, what's object, what's agent and theme, and then very explicit processes of formulating certain specific target sentences. And also, they can be a little difficult for our clinicians to administer for the same reason. So therefore, they've been, although they are quite effective, actual translation from the research setting to everyday clinical setting has been somewhat limited. So we do have two critical gaps that we can think about here. Number one, how can we expand treatment options available for sentence level utterances? And number two, how can we make them more accessible and easy to do without compromising theoretical grounding? So in order to address these goals, these gaps, my lab has been thinking about, can we use implicit structural priming as a novel way to facilitate language recovery in patients with aphasia. So what is structural priming? So structural priming is language users' unconscious tendency to reuse previously encountered or primed syntactic structures in future production and comprehension of sentences, because the primed structure becomes more accessible for them, therefore easier to use. So for example, if a speaker hears their conversational partner describing a transitive event using a passive structure, such as the grandma is tickled by the woman, then the speaker, when they describe a novel transitive event, they are more likely to copy the same structure describing the event in passive, the boxers chased by the girl, although technically using active sentences would be easier. Similarly, if they hear a double object dative structure, such as the voice giving a pirate a guitar, they are more likely describe a new dative event using same double object structure, the man's pouring the wife wine, rather than the prepositional dative structure, the man is pouring the wine to the wife, for the wife. But more importantly, structural priming is thought to is viewed to reflect how speakers learn to map certain messages into certain sentence structures based on prior linguistic experiences. So, for example, studies have found even though there are intervening linguistic materials between the prime sentence and the target sentence or increased time delay, the priming effects still tend to persist over that delay. In addition, as the priming experience increases over experimental trials or even across sessions, speakers do show cumulatively increased priming effects. And lastly, sentence structures that are less frequent or speakers who are less efficient, they tend to show larger benefit, larger priming effect, which is also known as inverse preference effect. And this makes sense from the learning perspective because when there's more room to learn, you get greater benefit from the priming experience. So in fact, the empirical evidence supporting priming effect is quite abundant and they are quite pervasive across different populations, languages, and different structures. We do see priming effects in children who are as young as 3-4 years old to older adults in their 80s, indicating that priming can make changes in speakers' language production across the lifespan. And also priming in one language can change choices of syntactic structures in the other language in typical bilingual speakers. And there's been more interest in applying structure priming in understanding and also in helping clinical populations lately. So children with developmental language disorders, they do show better use of grammar when they are implicitly primed. And patients with amnesia, although they cannot remember specific events of priming or specific prime sentences, they do still show implicit priming effect, which is very interesting. And more recently, there's been increased interest in using structural priming to assess patients with aphasia, as well as to facilitate their language processing in patients with aphasia. And studies have shown that patients do show increased use of complex sentences after following priming, although they couldn't produce those sentences independently. Okay. So for the interest of time, I'll briefly go over different theories of structural priming. So although we do know that, although it is really well established that priming effects happen almost everywhere with any structures across variety of different populations, why it happens is still being understood. So in some theories, structural priming is caused by spreading activation of the residual activation from the primed syntactic node. So once you are primed with double object, for example, when you try to describe a new dative event, that primed double object and syntactic configuration would, the residual activation from it would spread to the next sentence. In the interactive alignment theory, they suggest that structural priming reflects how interlocutors in conversation, how the process of language alignment between the two interlocutors. So by echoing or by aligning in their linguistic expressions, they can establish more shared understanding of the conversation. Therefore, information processing during the conversation between the listeners and speakers, it becomes more facilitated and easier. Some theories try to explain why structural priming support learning and how it support learning. In an activation-based theory, they suggest that with repeated activation or retrieval of the prime structure, although they short-term they decay, long-term over time it increases the base level activation of the syntactic chunk memory in our long-term memory. And as a result, use of the prime structure becomes easier and more efficient over time. On the other hand, prediction error-based theory, they suggest that speakers, as they process prime sentences, they incrementally predict upcoming word order. And when they encounter the word order that was different, deviated from what they predicted, this error makes adjustment in the weight connections between the nodes, between the word in the syntactic sequencing system, biasing the language production system to use the prime structure more frequently in the long run. So in this talk, without necessarily committing to one theory or the other, in this particular presentation, I do want to ask a rather clinical question, which is, can we use implicit structure priming to facilitate language recovery in aphasia? And I'm hoping to address this question by sharing some findings from our studies, past and ongoing studies. The first study, I'm going to briefly mention some evidence of structure priming sentence production in using a scripted dialogue task. And in the second study, priming, how we can use priming to facilitate early sentence planning processes using eye tracking while speaking paradigm. And then third study focusing on priming 애정, optional modifier 애정 phrases to increase information content in speech produced by patient. And then the next one, I'm going to talk about a group-based training study where we examine the roles of contributions of lexically mediated and syntactically based priming mechanisms for long-term, long-lasting, and robust training gains. And then lastly, if there's time, I'm hoping to showcase how structural priming treatment can be used as a personalized intervention for patients with aphasia. And then I wrap up this presentation by briefly mentioning our ongoing and future research directions. All right. Okay. So in this first study, my former PhD student, Grace, asked whether listening to conversational partner sentences would be sufficient to prime patients with aphasia to produce more complex sentences. And she used what's called a scripted dialogue like priming task, where Grace and the participant, they each had stacks of different picture cards, and they took turns describing their pictures in sentences with the shared goal of finding identical pictures. And when the examiner, who was Grace, when Grace and the participant had the identical pictures, the participants was supposed to say bingo. And the bingo pictures were mostly filler pictures, and they were included to make sure that the participant stay focused on the task, as well as to keep the nature of the experimental task more implicit. In other words, so that they do not know what we are looking for. So when it's her turn to describe her picture, Grace intentionally described her picture using either active sentence or passive sentence, which served as the prime. And then we measured when it's their turn to describe their picture, whether the participant would reuse the same structure that they heard Grace produce to describe her picture. So if priming was happening, then they would copy the same structure as Grace's. In addition, Grace also manipulated the time lag. So in the immediate priming condition, there was no filler intervening between prime sentence and the target description. And to assess longer term priming, Grace included two fillers between the prime and the target. So the participant and Grace, they describe these filler pictures before the target picture description. Okay, so that was the task. So we tested 19 PWAs and 20 controls. And here you see the results for the priming effect for the immediate priming and longer term priming. And y-axis showing percent passive structures produced out of total correct passive and active sentences produced. And red bars indicating passives produced after they heard Grace producing passive sentences, and then gray bars showing passive sentences produced after they heard Grace using active sentences. So as you can see at the immediate priming, both controls and PWA showed pretty robust priming effect. So they produced more passive after hearing passive sentences compared to active sentences, although the priming effects were generally larger for controls. And you don't have to worry about same and different verb conditions here. For the longer term priming, so when there were time delay with the intervening intervening filler trials between the prime and the target, overall the priming effects became smaller, which is consistent with the existing literature. However, both controls and PWA still showed smaller but consistent and significant priming effects. So, so this study demonstrated implicit priming mechanisms remain relatively preserved for patients with aphasia. Grace also did additional analysis to look at, what about over time? If priming is actually creating some kind of learning, will the patient show more passive sentences later in the priming session? And so she calculated cumulative passive proportion by trials. And then just, simple split of the session first half and the second half. And as you can see here, only the patient with aphasia, they showed more larger priming effect in the second half of the session compared to the first half of the session at both 0-lag and 2-lag priming condition, although controls did not show the cumulative priming effects. Right. So that's the first study. Let me move on to the next study. So in the second study, we looked at whether structure priming can also change how they plan sentences in real time. So we asked, does structure priming create gradual adaptation in the grammatical encoding system of PWA as measured by cumulative changes in both offline, not only in offline sentence production, but also in real-time sentence production? So we used, similar to the first study, we used a comprehension to production priming task, and we used eye-tracking. So for the comprehension priming trial, we used auditory sentence to picture matching task. So participant heard either active sentence or a passive sentence, and they saw two pictures where the thematic roles of the characters are reversed. And then after they hear the sentence, they were supposed to press a button to indicate which picture matches to the sentence that they heard. And then after that, they describe a new transitive picture. And obviously, you can describe this picture either in active sentence or in passive sentence. And while they are describing the picture, we monitored their eye movement. Specifically, we measured their eye fixations to the theme character to see whether priming experience from the comprehension trial will actually make their sentence planning processes more efficient. Okay, so here is our results for the offline sentence production results. So we tested 16 PWA and 16 controls. And when we looked at immediate priming, which is trial by trial priming, we found significant immediate priming effects only in the control group. However, we didn't see statistically significant priming effect in the patient group. However, trial by trial priming doesn't really show us what's happening over time. So we analyzed the data, including trial order as a factor, and then looking at the cumulative change again over the course of experimental session. And as you can see here, both controls and patients with aphasia showed cumulatively more production of passives as they experience more priming trials over the session. Okay. Not only that, when we looked at changes that happened in the pre-speech eye fixations, in other words, eye fixations that happened before they started producing the subject, the first word of the sentence, we found there was significant changes again. So on the y-axis, you see proportion of fixations to the theme per trial. On the x-axis, again, trial order. And blue bars indicate fixation changes for when they produce passive sentences. And the pink lines or pink shadows here, they show changes in the pre-speech fixations when they produce active sentences. So as you can see, the changes happened only when they produce passive sentences in the direction that they showed shorter fixations or less fixations to the theme before they started producing passive sentences more frequently and more accurately. And not only that, in both groups, not only that, the cumulative change that we saw in the pre-speech eye fixations that were larger, those were larger for the patient group, as you can see by the bigger slope here, compared to the control group. So these data suggest that structural priming results in cumulative adaptation in early sentence planning processes for patients with aphasia. So not only offline, but also their sentence planning processes. Okay. So in the third study, our PhD student, Peng, so the first couple studies that I just talked about, we are really talking about complex sentences and also syntactic choices between active and passives. But Peng took one step further from that, and she asked whether we can use structural priming to improve information content in speech produced by patients with aphasia. And the rationale for this study was that, as we all know, many patients with aphasia, they produce reduced information content, limiting their ability to effectively communicate in everyday context. And when we communicate, we use optional modifiers, which are called adjunct, such as, on the beach, by the weekend, next to the table, to really elaborate our message, to really convey more detailed and specific and yet, critical information about the event or what happened, where it happened, and how it happened in our daily communication. So here we asked, can we then use structural priming to increase production of adjunct phrases in patients with aphasia? So in her study, Peng used very clever pre and post priming block design. So in the priming block, participant did very simple listening and reading sentences prime task before they describe target pictures. But before and after post-priming, before and after the priming block, Peng included some picture description task to see whether they show changes in their discourse production as well. So Peng included picture description and also the picture description from the cat as well as the cookie theft picture. All right, so this was the okay. So this was the priming task that Peng used. The target pictures included intransitive actions with optional locative image in the picture. So in this case, you can describe this picture, the boy is crying, or you can say the boy is crying on the rug. And adding on the rug is completely optional, and you don't really need to do that, right? And but before describing the target picture, the participant read a prime sentence. And those prime sentences were either sentences without any locative phrase added in the sentence, which we call here baseline condition. And also prime sentences with locative sentences, as you can see here. And Peng, in addition to know which conditions tend to elicit greater priming effect, she also varied the repetition of the same location versus different location, as well as the position of the locative phrase in the sentence initial and the sentence final position. But I'll primarily focus on comparison between the baseline condition and the priming conditions. So here, the question was, do patients with aphasia and controls produce locative adjunct phrases more frequently after reading prime sentences compared to baseline condition? And the answer was yes. So in 20 patients with aphasia and 20 controls, in both groups, they produced more locative phrases after reading a single prime sentence compared to the baseline. And the finding was still consistent, although we didn't see the significant priming effect in this particular condition. But across the board, the patient group still showed significant priming effect. But these are immediate priming effects again. So Peng also looked at the structural priming lead to cumulative adaptation in sentence encoding processes in patients with aphasia and controls. And we did find actually greater cumulative priming effect in the patient group compared to the control group. Not only that, she also looked at, in that case, then who showed greater cumulative priming by looking at individual variability. And she found there was a significant interaction between the degrees of cumulative priming and individuals' aphasia severity levels measured by the WAB-AQ in the direction that patients who showed lower WAB-AQ, they tend to show greater cumulative change over time. Okay, this is the most interesting part. The last question that Peng tested was, well, in that case, then, if structure priming is really improving their ability to use adjunct phrases, does it generalize to discourse task? So using those picture description tasks that I showed, she calculated what's called locative phrase density. This is not a standard measure. This is something that Peng came up with by counting the number of locative phrases corrected for the number of utterances. And as you can see here, so compared to pre-priming block, which are indicated in pink or salmon color, both groups actually showed more adjunct phrases in their picture description after the priming task. And this is really cool if you think about it, because the priming task was really brief. It was only half an hour. So after that, half an hour, 30-minute priming task, patients, similar to the controls, they showed more, they produced more elaborated speech. And this is just example comparing cookie theft picture description from one of the participants. So the yellow highlights include shows their production of adjunct phrases. So you can see that before the priming task, very few, but then after the priming task, you can see a lot more use of adjunct phrases. Okay. All right. So far, I showed structure priming can facilitate use of more complex sentences in patients with aphasia, and it creates cumulative changes in their sentence planning processes, and as well as it can potentially increase information content in their language production. However, all these three studies that I presented on, they are really from single session experimental studies. So they don't really tell us much about really long-term effect. So the next studies that I'm going to talk about are part of our ongoing project funded by NIH. And this is a work where we really dive into using structure priming as a treatment component. And I want to acknowledge that Vic Ferreira and Nadine Martin are my co-investigators on this project. And also I want to acknowledge our former and current postdoc who have been really contributing a lot to this project. So here we ask two questions: whether structure priming can be used as a treatment to elicit more long-term and more broader changes in their language processing system. And secondly, if they do, then really identifying what are the essential components of structure priming treatment that are critical for maximum training outcomes. So we have four different studies under this project. And to answer these questions, we actually incorporate existing learning theories of structure priming and also outside of the structure priming literature to really delineate the essential learning conditions. So in study one, we compare error-based versus activation-based learning. In study two, we compared abstract versus lexically mediated syntactic priming mechanisms. And then in study three, which we are wrapping up right now, we compare restudy condition and retrieval practice condition. And in study four, we conduct phase one treatment efficacy study, kind of putting all the essential ingredients from studies one to three together using single subject-based design. So for the interest of time, I'm going to show the data from our study two, and also hopefully I can showcase some cases from the preliminary findings that we conducted in preparation for our upcoming study four. All right. So so in study two, we examined, like I mentioned, how lexical information and syntactic information, how they contribute to long-lasting and robust treatment gains in patients with aphasia. So the study literature shows that structural priming can be multifactorial with its longevity and strength can be being modulated by abstract, at least abstract syntactic priming mechanism and lexically mediated boost. So structural priming can be facilitated by implicit learning of syntactic phrasal structures independent of lexical semantic content between the prime and the target sentences. So as you can see in these examples between the prime and the target, the boy gave the girl a book and the man threw the dog a bone. You can see that there is no lexical semantic overlap between these prime and the target, but only the syntactic representation or syntactic combinatorial nodes, they are shared, spreading from the prime sentence and target sentence. However, structural priming can affect the size of the structural priming can also be enhanced by additive activation from the lemma to associated syntax. So as you can see here, between this prime sentence and target sentence, we can repeat the same verb. In that case, there is additional boost coming from the shared lexical information. Thus, the magnitude of the priming effect becomes enlarged. However, studies show that although the lexical boost effect tend to be bigger than abstract structural priming effect, they do not always long lasting. So this is an interesting question when we think about when we situate these in the context of aphasia treatment that we know how to do right now, because generally we think that when it comes to treatment, we want to really support our patient's ability to perform during the treatment or provide maximal support for our patient. Therefore, we tend to use same verbs when we try to teach them to produce sentences, thinking that that information from the verb will really help them to produce sentences or to structure words around the verb. So so this will be interesting whether it is still the case when it comes to using structure priming as an implicit learning mechanism to improve aphasia. So in this study, we asked, the purpose was to examine how lexical and syntactic information modulate long-term gains of structure priming training in patients with aphasia and controls. The first question we asked was whether structural priming training create lasting and generalized improvement as measured by maintained improvement at 1 week post-training. And and generalized improvement to untrained stimuli that the participant did not see during the treatment sessions. And then the second question was again, which learning condition between the same verb and different verb priming training support greater gains in patients and controls in the trained modality, which was sentence production, as well as across untrained modality to sentence comprehension. So we trained 24 patients with aphasia in this study and 16 controls. The target sentences were passive sentences and double object dative sentences. We chose these sentences specifically because there is largest empirical evidence for these specific sentences from the literature. And we also know that these sentences are often difficult for patients with aphasia. And given the purpose of study, trying to tease out the essential mechanisms, that was we wanted to start with these sentences. So this is the design and training assignment sequence. So at baseline, all participants completed sentence completion probe as well as sentence production probe. We also had additional probe measures, but I'm going to focus on only these two for this part. And then 16 controls and 16 patients with aphasia. They received 2 phases of structural priming training, and each phase consisted of only 3 sessions of priming training. So we kept it relatively short. And within each phase, they were trained on either passive or DO target structures, and each phase was trained on under either same verb priming training or different verb training with the training condition and the target structure crossed, counterbalanced across the participant. And then after each phase, we did post-testing, repeating the same baseline measures at 1 day after the third training session and 1 week after the third training session. And then they took a break for 2 weeks, and then they came back to do the second phase of the training. And the data from the first post-testing served as a baseline for the second phase of treatment. And then after the treatment was done, we did 1 day and 1 week post-testing again. Right. We also had 8 additional patients with aphasia who are milder, and they did really well with passive, so we didn't really have a reason to train them on passives. However, they really liked us, so they wanted to work with us, so we didn't want to send them away. So we put them only in the DO training condition with the treatment, with the training condition as a between subject factor. And then we just did 1 day and 1 week follow-up after only 1 phase of training. But when we did data analysis without or including these 8 additional PWA, the results were exactly the same. So today I'm just going to present the data from all these 24 patients with aphasia. So this was what each training trial sequence looked like. It was really simple. It was pretty simple, following kind of like a commonly used structure priming paradigm. So participant read 2 prime sentences. They heard and they read these 2 prime sentences, and then read 1 filler sentence, and then they completed target sentence, and then more filler sentences, and then memory probe, not to really test their memory, just to keep them engaged so that they stay attentive to sentences that they were reading. And the critical experimental manipulation was whether the same verbs were used between the prime sentences and the target or not. So for the same verb priming training, we repeated the verb across the 3 sentences, so between the 2 prime sentences and the target sentence, thus engaging not only abstract syntactic priming, but also lexically mediated boost. In the different verb priming condition, however, all the verbs were different and all the nouns were different across the sentences, across the between the primes and the target sentence. Therefore, making the priming making the priming effect come primarily from shared abstract syntactic representation. Okay. So here you can see some of our example stimuli for the sentence completion and production probes. In the sentence completion, we gave them overall sentence frame, and then the task specifically measured their ability to assign thematic roles. And for the production task, they had to complete most of the sentence. Therefore, we are assessing their ability to construct overall sentence predicate structure. And each task included trained stimuli as well as untrained novel stimuli. Okay, so here are the data from sentence completion probe showing a baseline, 1 day post and 1 week post. Here we have percent correct data and control group patients with aphasia, and after different verb training condition and after the same verb training condition. And as you can see, for control, sentence completion probe was really easy. So they showed ceiling performance. So we focused on analyzing patients with aphasia data only. So in both conditions, the patient group showed significant improvement, significant at 1 day post-testing, as well as maintenance at 1 week post-testing. However, interestingly, when we compared the training condition effect, we found greater improvement after the different verb training condition compared to the same verb training condition in our patient group. And this is the data from our sentence production probe. So you can see that both groups again show a significant training effect and as well as maintenance effect in both training conditions. However, when we look at training condition by session interaction, we see that in the control group, the control group showed significantly more changes after the same verb priming training. However, in the patient group, again, they showed more improvement following the different verb priming training compared to the same verb priming training. What about generalization to untrained stimuli? So here we compared changes for the trained stimuli, meaning that the stimuli that they saw during the training sessions versus novel stimuli that they were not exposed during the training sessions. So if we see no significant effect of exposure, then it means that it's a good thing, because it means they could generalize the priming-induced learning to novel sentences. And that's what we found in both sentence production and sentence completion data. Neither group showed the effect of exposure, indicating significant generalization to untrained stimuli. Okay, so those are the data from the production piece. We also asked whether after the priming training in sentence production, whether they would show cross-modality generalization to sentence comprehension. And to do that, we used eye-tracking sentence comprehension task. We used webcam eye tracking and really spearheaded by our former postdoc, Willem van Baxel. So this is Willem doing calibration on himself. And the task that we used was auditory sentence picture matching task. So for the passive targets, they heard WH passive sentences, as shown here, who is lifted by the mailman here. And while they are listening the question, they also saw these two pictures where the thematic roles of the characters are reversed. And as you can see, in the initial part of the sentence, either picture can be the correct picture. However, when you hear the mailman, then it becomes clear which picture should be the target picture. So this the main man is the disambiguation point for this target WH question. Similarly, for the double object target sentences, we used WH question. So who is giving the artist coffee here? And again, the artist would be the disambiguation point. So we measured their eye fixations to the pictures while they are listening to the sentence. And we looked at whether, after the disambiguation point, whether the participant would look at the target picture more frequently and faster after priming training compared to before training. And we also measured their picture matching accuracy as well as response time. Okay, so here are comprehension, picture matching accuracy, and response time. We are still working through the data analysis, so these findings are a little bit tentative. But in terms of picture matching accuracy, we found that our WH questions, including passives and DOs, were kind of difficult. So we didn't really see significant changes after training. However, in their response time, both groups showed faster response time after training. So P1 is 1 day post, and then P2 is 1 week post again. Following training, both groups showed faster response time in selecting correct target picture. However, interestingly again, control group showed more change in their response time following the same verb priming training compared to the different verb training. However, patients with aphasia showed more significant reduction in their response time following the different verb priming training compared to the same verb priming training. And eye fixation data here. So we found similar patterns. So here the line shows disambiguation point. And control groups showed changes. They looked at the target picture more frequently after the training. However, that change was greater following the same verb priming condition. As you can see here, bigger bump for the blue and green lines compared to red. However, patients with aphasia, they showed changes later in the sentence compared to controls. But again, they showed greater changes in their eye fixation after the different verb priming condition, but there was no significant improvement in their eye fixation following the same verb priming condition. So together, in this study, we found that structure priming training resulted in enduring and generalized improvement in patients with aphasia. Control showed greater gains following same verb training, indicating that they can use both lexically and abstract mechanisms of priming to support learning. However, patients with aphasia showed no benefit of lexical boost, but greater gains following abstract priming. And our current, explanation is that maybe greater variation in the experienced lexical syntactic input may facilitate abstract rule learning more so that they can be generalized to different contexts to a greater extent, as also shown in children as well. So this study together suggests that processing of abstract syntactic structures across multiple exemplars is a key learning condition for robust and enduring outcomes. Okay. So I'll go over briefly, you may wonder how you can use actually structure priming for more traditional treatment. In this study, Caitlin and Hannah, they asked, can we use implicit structure priming as a personalized treatment for patients with aphasia, replicating one of our previous studies with 2 different patients with aphasia at different severity levels. And we also delivered this study over virtual, and then we measure treatment effect up to 2 weeks. 2 months, sorry. Task was really simple, reading prime sentences, filler sentences, and describing the target picture, and then recognition probe. And this was what we found in one patient with agrammatic aphasia in Lee and Man. As you can see, this patient could not produce any dative sentences at the beginning, but then over time, she was able to produce more sentences independently, and this effect was maintained even up to a month. So in this study, we recruited 2 patients with broadcast aphasia, and 1 patient was more severe. She could not produce even simple active sentences, so we targeted active sentences using structure priming training. The other person was more milder, so we targeted prepositional dative sentences. As you can see, in both cases, they showed significant and steady improvement for both trained and untrained sentences. And those effects were maintained at 1 month as well as 2 months in both cases, although this person showed more variation. This data is from our earlier patient. So you can recognize this speech sample. We also found quite significant notable changes in their discourse production. So you can see the beginning, it was all single words, but then after the treatment, the patient was able to produce a lot more sentences, which is quite significant and quite remarkable. Right. So I know I'm almost out of time, so I'll go through this really quickly. So I hope that I could show, I was able to show that grammatical encoding deficits are common in patients with aphasia, resulting in widespread communication difficulties. And structure priming facilitates language processing and recovery in aphasia. As shown by some of the data that I presented, patients with aphasia show preserved implicit structure priming, which is more in line with the processing view of aphasia. And patients with aphasia do show long-lasting and cumulative improvement in offline production, real-time sentence planning, and connected speech. And in some cases, patients with aphasia show greater cumulative learning than controls. And encoding abstract grammatical structures is probably an essential cognitive mechanism that support robust and enduring aphasia recovery. And more broadly, in terms of clinical implications, we think that these findings suggest that implicit structure priming treatment is a promising novel aphasia treatment, capitalizing on preserved linguistic knowledge in patients with aphasia and possibly overcoming some limitations of the current aphasia treatment. So to wrap up, we are expanding the clinical impact of our work toward more holistic and sustainable aphasia rehabilitation through implicit language learning. So in our upcoming treatment study, we are including some measures to ensure more robust generalization to naturalistic speech, such as storytelling, as well as our postdoc Catherine and Peng, PhD student, they are working on using network analysis to really measure more internal changes in the organization and structure of their syntactic network. And also we are planning to do more multimodal priming effects, from reading to speaking or vice versa, again, to broaden the impact of generalization effect, and also improving 2 languages in bilingual aphasia by leveraging priming of shared abstract syntax, as well as using large language models to assess which client would benefit more this priming training, as well as whether we can use language models to adjust stimuli levels for different clients with aphasia. But this is very early, and I have a few slides, but I think for the AI piece, but I stop here because it's already 12:30, and then yes, and so I stop there, and then I'll take questions.
Thank you, Jiyeon. I'm going to start with questions from our room here. Anybody? Yeah, William actually has a question.
Thank you for the talk. I wonder if you could talk a little bit about different subtypes of aphasia and the extent to which you think these results generalize or may be different depending on the subtype. So if you could talk about that.
Yes, that's a great question. We did not really look at the subtypes of aphasia yet. But when we recruited this patient, we did a set of baseline measures, and we recruited patients who show sentence production difficulties specifically. So a lot of these patients, they presented with kind of non-fluent agrammatic type aphasia. However, some patients, according to classic classification, they did still show more fluent type of aphasia. However, they still had sentence production difficulty. So therefore, we recruited them into our training study. Oh, you had another piece to your question, right? In terms of who may benefit, we are actually looking at like more individual differences to really understand who's benefiting from this structural priming treatment. And we don't really get super consistent findings when we use traditional measures of traditional clinical test batteries, like the WAP, for example, except when we look at like cumulative learning. But what we saw was sometimes when they show greater production deficits on the tests like NAFs, in certain studies, we do see greater priming effects for those patients. And we also looked at like cognitive skills. So we measured like their explicit memory, implicit memory using tasks like serial reaction time, fixture fragmented picture identification task, as well as like verbal working memory. In patient, so far what we are seeing is that patients who have more stronger implicit learning ability, they tend to show greater changes after training. So those are kind of like emerging patterns.
Great. Any other questions? Yep, Sarah, and then Manora.
So kind of going off of that just a little bit, I've kind of heard of a similar study, but they kind of refer to it as syntactic alignment or audience design instead of priming.
Yeah.
And in that context, like personality traits, like how empathetic you are, how social you are, could contribute. And I was wondering if there are like demographic features or personality traits that would actually would cater to different patients, so that you would be like, if someone is highly empathetic, then they would adapt more, right, to word choices or tone or sentence structure.
Yeah, that's a great question. And we do not know the answers yet, at least, for patient group. I can totally imagine, especially when you do this priming in a more interactive task or under kind of like shared some kind of shared communicative goal. I can see, depending on some people, they may try to align with the other person, right? So there can be other like personality traits and social factors. We've never looked at that question, and partially, in part because I don't really know like how to measure those things yet. So if you have suggestions, I will be happy to hear. But I can share some findings from other studies. So there was a study that looked at how syntactic alignment happens when you do a dialogue task with human versus avatar, but avatar with kind of robot face versus like human-like facial features. I think if I remember the findings correctly, they found that like human-like facial features showed similar degree of syntactic alignment as humans. And right now in my lab, we are also using socially assisted robots in collaboration with our computer science department at Purdue, whether we can use those robots as a potentially therapy agent, down the road, because we have limited speech services available for clients with aphasia, right? And so far, we are actually finding quite comparable linguistic alignment effect between humans and robots, but we haven't looked at it yet. But I thought for robots, it's going to be more important for their like what they look like, because we have one robot that looks like a real robot, and then the other robot that has like human faces that moves, eyebrows, things like that. But we are actually getting the data, the robot that looks like a real robot, but it has like more like natural, like prosodic intonation than robot likeness voice. we are getting like slightly higher alignment than like the robot with kind of flat voice. So I think there are definitely like non-linguistic factors that could influence degree of linguistic alignment.
I can see some really nervous looking SLPs here in our room, Jiyeon.
Yeah, yeah, but yeah.
Any other questions from our? Okay, we got some questions online. I think William's question on the different groups aligns with Yasmin Faraki Shah's question, because she asked whether your PWA group consisted only of agrammatic speakers, but I think you've kind of dealt with that, right?
Yeah, it included more than agrammatic patients. Yeah.
Right. Then we have a question from Malathi Lothathari. Why do PWA show larger cumulative priming effects than controls? Is it only because of performance differences, PWA start lower, or because the mechanisms are somehow different or stronger in aphasia? And then she has an addendum. Do the same verb versus different verb results in controls versus people with aphasia suggest different mechanisms? How sure are we that it is priming in both cases?
Okay, so I hear like three questions. So the first one is why patients with aphasia show greater cumulative priming effect. I don't think it is because they studied low necessarily. Maybe that is part of the reason. But I think it aligns with some of the previous findings from the structure priming literature showing that, you know, speakers who are less grammatical knowledge or who are less skilled, then when they are primed with a structure that they are not super familiar with, then they show greater priming effect. So I think we interpret that as more of like gradual learning that is created by the priming effects because of the difference, you know, because patients are more impaired. So they get more benefit and that creates more changes over time in their system compared to the control speakers who already have, you know, good grammar and who already can produce, you know, passives or double objectives or whatever, you know, structure that we are priming, you know, pretty well. So there's a little change that priming creates. So that's kind of like how we interpret it. And I think it's largely consistent with what has been shown in child language literature as well using structure priming. Well, you may know this better. Also, some studies from second language acquisition, if I'm not mistaken. And then the second question was something about same verb and different verb priming, right? Dirk, do you mind repeating the question?
Yes, sure. Now, if the different results for the same verb versus different verb, does that suggest it? So in controls versus PWA, does that suggest different mechanisms between those two groups? So how sure are we that it is priming in both cases?
Oh, yeah, that's a great question. So I think, so when you say how sure it is it's priming, are you like specifically referring to like priming of syntactic priming, I assume?
I think that's the question to you.
Okay, yes. So for controls, we have relatively small number of participants compared to, you know, all these like other like structure priming studies that like tend to recruit like 100, you know, participants. So, but what it tells us is that controls do rely on, or they use maybe, you know, multiple information, you know, not only from the shared like grammatical syntactic information from prime and the target, but also they take advantage of the lexical boost. So so I think that both mechanisms are really working in patients with in control participants. For the patient group, so we are thinking that okay, so we are not really sure why they don't really show lexical boost effect, and we are actually finding that even in like short-term like priming effects. So it could be that patients with aphasia, their ability to, use lexical information, or, maybe lexical information becomes like decayed a little too fast before they exert any kind of like long-term changes on their sentence production. But we think that these mechanisms per se are not different, but what works better for each group is different. So it seems like patients group, they get more benefit, or maybe it helps for them to figure out, those abstract grammatical rules when they see more diverse lexical semantic exemplars. It's just somehow it helps them more, which seems a little, uh, different from what we would expect. So I think that's what's going on.
And we have yet another addendum or an explanation of the question by Malafi. She wonders whether a cross-verb learning in PWA is something like analogy or other learning mechanisms that has been proposed in the child language acquisition literature.
Yeah, I think we are actually wondering that's what's going on. Like in the child language literature. Okay, I'm not an expert, but didn't they also show when you use like more verb exemplars, then they tend to show greater like grammar acquisition compared to when you repeat like same verbs over and over. So I think same type of processing is maybe going on in our patients with aphasia. So yeah, that's a great question that I want to keep thinking about.
Yeah, it's related to a question that I had put in the chat. So would you agree? So this, yeah, I'm wondering what you will say. Would you agree that evidence of preserved priming effects in people with aphasia with grammatical output problems implies that such output problems are due to a processing problem rather than a representational syntactic problem? Or in other words, how could priming work mechanistically if it's
Yeah.
not reliant on preserved structural knowledge? And then
Yeah.
related to that, are there individual people with aphasia who are not sensitive to priming at all? And if so, do you suggest that those people have a different kind of syntactic problem that is maybe more representational?
Yeah, it's a great theoretical, broader implication question. Yes, for the first part, yes, I do think it is really, these data are really supporting that they do have somewhat preserved grammatical knowledge in their system, because priming doesn't really create their grammatical knowledge, to my understanding. It's more like really helping them like boost it, like helping them access the grammatic representation more easily. And the idea is that there is some kind of spreading activation, at least, from what they heard immediately, and then, what to come next. So I think it is supporting that, supporting the processing view of aphasia. But obviously, like you mentioned in the second part of your question, maybe we will have some patients whose grammatical knowledge itself is quite impaired. Then do they show structural priming effect? I do not know the answer to the question yet, but I do see a lot of individual variability. Some patients show really strong priming effects, some patients don't. And I've been wondering what makes the difference. So one thing that I was thinking, and this is totally like, based on my observation, we haven't looked at the data, whether they have to have some ability to like comprehend or like process certain degree of syntactic information to be able to really get benefit from like priming. But that's again empirical question. So I think depending on how much intact grammatical knowledge is in their system, I think we may see different degrees of priming effect, and that can potentially dictate, who will benefit from structural priming training or not.
Great, thank you. We had one informational question from Parisa. I think this was related to the first study that you presented, whether you can mention the age range or the age mean of the two groups, persons with aphasia versus the control groups.
Yes, so they were generally matched in terms of age and education. So their age range was really broad, from like 30s to our age range for patient group is from 21 to like 80. So it was anywhere, somewhere. And we try to match our control group in terms of their age with the patient group.
Great. Thank you very much. That brings us, and as I say that, a new question pops up. Okay, so this is the last question. Again, from Parisa. Regarding the discussion on same different verbs, we know that syntactic priming in natural settings often occurs alongside semantic priming or lexical boost. This
Yeah.
makes it difficult to disentangle the effect of syntactic priming from lexical influences or determine which is driving the other. Given this, I believe that in patient treatment training, both syntactic priming and lexical support should be incorporated so that individuals with aphasia can benefit from both mechanisms. And she says, that's not a question.
Yeah, I
course.
think, yeah, I think you can, but our, study 2 data is showing, I think lexical boost can be definitely incorporated for like immediate boost, but we do find this pattern again and again. It doesn't really create like boost in terms of like long-term changes. So I think it helps in terms of like for them to kind of like use that specific information and really support their immediate like production, maybe based on like item specific, lexical item specific additional cueing. But in terms of like more like wide like changes, like subtle implicit learning, lexical semantic overlap doesn't seem to help. So maybe initially to help the patients to understand the task, I think we can incorporate, but at least the empirical data from my lab doesn't really support, like it's like a way to go for everyone.
Great. Thank you very much, Jiyeon. On that note, I think we came to the end of the questions. Thank you so much for your presentation. That was awesome. Thanks to the
Thanks,
audience.
everyone. Okay. Thank you, everyone. Everyone have a good weekend.